Most people think diabetes is just one disease. It isn't. There are actually 6 different types, and some of them are misdiagnosed for years, even by doctors. 96 million Americans have prediabetes right now, and most of them have no idea. Today, we're breaking down every single type of diabetes, simply and clearly. By the end of this video, you'll understand something most people never do. Stay with me. This one is important. Your pancreas is a small organ sitting just behind your stomach. Its job is to produce insulin. Insulin is the key that unlocks your cells, allowing sugar from your blood to enter and give you energy. When that system breaks down, for any reason, diabetes develops. But the reason it breaks down is different for every type. And that difference matters enormously, because the wrong diagnosis means the wrong treatment. And the wrong treatment means years of damage that could have been prevented. Let's go through each type now. Type 1, diabetes. Type 1 diabetes is an autoimmune disease. That means your own immune system is the problem. For reasons that aren't fully understood, your immune system attacks and destroys the cells in your pancreas that produce insulin. These cells are called beta cells. Once they're gone, they don't come back. Your body simply stops making insulin entirely. Without insulin, sugar builds up in your blood instead of entering your cells. And without energy reaching your cells, your body starts breaking down fat and muscle for fuel instead. This is called diabetic ketoacidosis, and it can be life-threatening if not treated quickly. Type 1 is usually diagnosed in children and young adults, but it can develop at any age. It has nothing to do with diet or lifestyle. You cannot prevent type 1 diabetes. People with type 1 need insulin injections or an insulin pump every single day to survive. Warning signs include extreme thirst, frequent urination, sudden weight loss, and constant fatigue. If these symptoms develop quickly, especially in a young person, seek medical attention immediately. Type 2 diabetes. Type 2 is by far the most common type. It accounts for around 90% of all diabetes cases worldwide. But unlike type 1, your pancreas doesn't stop making insulin completely. Instead, your body stops responding to it properly. This is called insulin resistance. Think of it like a lock that no longer responds to the key. Your pancreas tries to compensate by making more and more insulin, but over time, it can't keep up. Blood sugar levels rise and stay high. Type 2 develops slowly, often over many years. And here's what makes it so dangerous. Most people have no obvious symptoms in the early stages. They feel fine. Meanwhile, high blood sugar is quietly damaging their blood vessels, nerves, kidneys, and eyes. Risk factors include being overweight, physical inactivity, poor diet, and family history. And age plays a huge role. Your risk increases significantly after 45. The good news, type 2 can often be managed and even reversed with lifestyle changes. Weight loss, exercise, and diet improvements can make a dramatic difference. Warning signs include increased thirst, frequent urination, blurred vision, slow healing wounds, and tingling in the hands or feet. If you have any of these, get your blood sugar tested. Type 3 diabetes. This one surprises most people. Type 3 diabetes is the term researchers use to describe the link between insulin resistance and Alzheimer's disease. Some scientists now believe that Alzheimer's may actually be a form of diabetes, specifically affecting the brain. Here's why. Your brain needs insulin to function properly. When brain cells become resistant to insulin, they can't get the energy they need. Brain cells start to die. Connections between neurons break down, and memory, thinking, and behavior all deteriorate. Research from Brown University found that insulin resistance in the brain is directly linked to the development of Alzheimer's disease. This is still an emerging area of science. Not all doctors use the term type 3 yet, but the connection between blood sugar, insulin resistance, and brain health is becoming impossible to ignore. This is why managing your blood sugar isn't just about your body. It's about protecting your brain, too. Warning signs overlap with early Alzheimer's: memory lapses, confusion, difficulty concentrating, and mood changes. If you or someone you love is experiencing these, speak to your doctor. Type 4, gestational diabetes. Gestational diabetes develops during pregnancy. It affects around 10% of pregnancies in the United States every year. During pregnancy, your body needs more insulin than usual. In some women, The pancreas can't keep up with that increased demand. Blood sugar levels rise, and gestational diabetes develops. The important thing to understand is this. Gestational diabetes usually has no obvious symptoms. Most women only find out through routine pregnancy screening. This is why prenatal testing is so important. Left unmanaged, gestational diabetes can cause complications for both mother and baby. Babies can grow larger than normal, making delivery more difficult. And there's a long-term risk too. Women who develop gestational diabetes have a significantly higher chance of developing type 2 diabetes later in life. Up to 50% of women with gestational diabetes will develop type 2 within 10 years. With proper diet, exercise, and monitoring, gestational diabetes can usually be well controlled, but it must be taken seriously from the moment it's diagnosed. Type 5, LATA. LATA stands for latent autoimmune diabetes in adults, and it is one of the most commonly misdiagnosed conditions in medicine. LATA is sometimes called type 1.5 diabetes because it sits between type 1 and type 2. Like type 1, it's an autoimmune condition where your immune system attacks your beta cells. But unlike type 1, it develops very slowly, over months, sometimes years. The problem is this. Because it develops slowly, and because it usually appears in adults over 30, doctors often mistake it for type 2 diabetes. They prescribe type 2 treatments, but those treatments don't work for LATA because the underlying cause is completely different. Meanwhile, the immune attack on the pancreas continues silently until insulin production fails completely. Studies suggest that up to 10% of people currently diagnosed with type 2 diabetes actually have LATA. If you have been diagnosed with type 2, but your blood sugar isn't responding well to treatment, ask your doctor about testing for LATA. Warning signs are similar to type 1, but develop much more gradually. Fatigue, thirst, frequent urination, and unexplained weight loss. Type 6, MODY. MODY stands for Maturity Onset Diabetes of the Young, and it is the rarest and least understood type of diabetes. Unlike type 1 and type 2, MODY is caused entirely by a single gene mutation. It is inherited directly from a parent. If one parent has the gene mutation, each child has a 50% chance of inheriting it. MODY is often mistaken for either type 1 or type 2 diabetes, but the treatment is completely different. Some forms of MODY can actually be managed with simple medication rather than insulin, which means a correct diagnosis can dramatically improve a patient's quality of life. MODY usually develops before the age of 25. But because it's so rarely tested for, many people live with it for years without the correct diagnosis. There are currently at least 13 known subtypes of MODY, each caused by a different gene mutation. If you have a strong family history of diabetes, especially diagnosed at a young age, ask your doctor about genetic testing for MODY. Warning signs include mild to moderate high blood sugar, often without the typical symptoms of thirst or frequent urination. Those are the 6 types of diabetes you need to know. Type 1, Type 2, Type 3, Gestational, LADA, and MODY. Each one is different. Each one requires a different approach, and knowing which type you're dealing with or which type you might be at risk for could completely change your outcome. If you found this video helpful, hit the like button and subscribe. We break down health topics like this every single week. Drop a comment below. Which type surprised you the most? Your health deserves your attention.